Welcome back to another edition of Straight Talk with Tracey. I'm honored to be speaking today with two very special guests. By phone, we have United States Senator Chris Murphy, a Democrat from Connecticut, and in our studio, Dr. John Santopietro, President and Medical Director of Silver Hill Hospital. Gentlemen, thank you both so much for joining me today. You are both excellent spokesmen on the state of mental health treatment from a national perspective, both from the policy and the clinical point of view. Senator Murphy, I'm going to start with you. You and Senator Bill Cassidy, a Republican senator from Louisiana, collaborated with mental health professionals, policy experts, consumers, and family members to develop the bipartisan Mental Health Reform Act, which was signed into law by President Obama at his final bill signing ceremony in December of 2016. This bill created the most significant reforms of our mental health care system in decades. So, Senator, what drew you to the issue of mental health care?
Well, it's an issue that confronts every single resident in Connecticut. This is a disease and illness that doesn't care whether you're a Republican or a Democrat. It doesn't care whether you're white or black, and everyone either has experienced mental illness themselves as a family member or a close friend or loved one, and anybody that has dealt with recovery and dealt with treatment knows that the system is unfortunately set up for far too many to fail. So I've been working on the issue of mental illness since I was in the state legislature 20 years ago, and so this is a continuation of a lifetime of work for me. My family is no different than others. We have a frankly proud history of mental illness. We don't look at it any differently than our broken legs or our heart disease. It's just another ailment that we have found a way to deal with, but many can't. Many can't access the system. So our bill, is comprehensive. A lot of it revolves around future funding commitments, but a big part of it was cracking down on insurers and making sure that insurance companies are actually paying for mental health treatment, which they haven't been doing, even though the state and federal government have passed laws requiring that you cover mental illness. That doesn't actually mean that insurance companies are approving coverages, are actually paying the claims, and so that was a big part of our legislation. But you just can't represent the state without hearing about this issue, hearing about the trials and tribulations of patients, and that's what drove me to introduce this legislation. And it was a long time coming. We worked on it for 2 full years before we got it passed, but I'm glad that we got it done in a town where not a lot gets done, unfortunately.
Yes, and we are extremely grateful as clinicians that you did as well. So what are the key components of the Mental Health Reform Act?
So there's a number of provisions in the bill. First, it sets up a new position at the very top of the Department of Health and Human Services, someone dedicated to mental health and addiction. Amazingly, we've never had an assistant secretary for addiction and mental health, and now we do. So that person wakes up every single day thinking about how to best coordinate policies on behalf of people with mental illness. Second, it set up a number of programs to fund evidence-based mental health treatment, and some of them are now getting their first rounds of funding. For instance, we have a great program in Connecticut, evidence-based, regarding pediatric telehealth, making sure that pediatricians have immediate telephone access to mental health professionals. So if they get a child in their office that's presenting symptoms of mental illness, they can get an expert on the phone. We've pioneered that in Connecticut. We now have money to expand it nationwide. And then lastly, as I mentioned, it does a lot of things, but sort of the three top things are those two, and then the requirements that insurance companies start paying claims for mental illness. It basically says if you're paying a smaller percentage of claims for mental illness than you are for, illnesses below the neck, then you're in violation of the Mental Health Parity Act, and it gives the administration the power to enforce that.
Senator, this is John, and first of all, thank you for being one of the top voices for mental health in the country, and those of us in the trenches really appreciate that. And just another question on parity. Clearly, Connecticut had been a leader in that. The Congress had done quite a bit on it over the years, and so did your work on the Mental Health Reform Act. But as as we read in the papers and those of us on the street know, we're still not there, right? And so can you just give us I'm just interested in an update. How's it going? How's the fight going? We're all in it with you in terms of parity. What do you see as the next steps?
Well, you know, the first set of fights on parity were about coverage. And so, you know, parity initially was about making sure that your plan covers mental illness and addiction in the same way that it does other types of health care. And so we were successful in that. We got a state law passed. Many other states passed it. The federal government eventually passed it. The problem is, as you know, while people technically have the benefit, they can't access the benefit because there's all sorts of red tape and bureaucracy and prior authorizations that are involved in getting the mental illness and addiction treatment that aren't, frankly, standing in your way when you're trying to, you know, get surgery on your, you know, busted knee covered. And so that's what our new language does, is it says it's not just the statement of benefits, it's the administration of the benefit. The Trump administration, you know, has been here and there on this. All of the provisions of our bill require the administration to actually enforce the new law. They have not been overly aggressive, and yet they've been moving slowly ahead with the regulations and guidance that they need to in order to get the job done. And in fact, I'll give them credit. The Secretary of Labor actually came to the Congress recently and asked for new powers to go directly after insurance companies in new and more aggressive ways. And we're going to hopefully give him that authority this year here in Congress. So we've got to get the administration to move faster. Provisions, but yeah, it's now moved to a fight about making sure that insurance companies actually pay the claims that they told you they were going to pay when you got the insurance benefit.
So, in addition to parity, what do you see as the major barriers for implementations of these programs, such as the wonderful telehealth program that we have here in the state of Connecticut?
Well, I still have a lot of worries. You know, one is the reimbursement rates are so low, especially in Medicaid, that it's hard to find clinicians who will get into this space. And so we've got to think about paying professionals what they deserve, and thank goodness for Silver Hill and all the great work that you do there to provide access. We also have an unbelievably siloed system of care. You know, we have a million different ways that we pay for mental health. We have some facilities that are grant funded, others that provide fee-for-service care, others that are part of bigger systems of care and have more outcomes-based reimbursements. There's lots of private pay in this space because there's some families that just want to pay out of their own pocket and have the means to do it. We have a really fragmented mental health system, and at some point we've got to reconcile that as a state. We've got to, I would argue, you know, have some bigger provider networks, have more integrated systems where mental health and non-mental health, physical health, are together under the same system. That's not what we do today. That integration of care is one of the biggest barriers to getting good treatment.
Yeah.
I was going to say also, as you were talking, Senator, I was thinking of the recent reports, I know you know about them, from NAMI and Milliman on access, that you know, something like 35% of people that are accessing mental health care that have private insurance even can't find help, and the percentage of people that need to go and pay out of pocket is extraordinarily high relative to physical health. So, and that's why it's so great. We know this isn't going to happen overnight. It's been a years-long fight. It's sort of like there was the Fair Housing Act, and then there was a lot of work that people like you had to do. I guess do you have a sense of? I mean, what's your message to those of us in the community of treaters and in the community of people going and speaking with our representatives? What can we do to help you in the fight?
Well, I mean, listen, I just think we have to, continue to insist that we view mental illness and addiction in the same way that we view the rest of the healthcare system. There's still this stigma around mental illness, and much of it is because we have separated its treatment. We've pushed its treatment, outside of our hospital systems and our, traditional healthcare system, and we've allowed insurers to reinforce that discrimination. So I just think we have to continue to insist that anyone with a mental illness gets the same exact care that somebody with a cancer or an orthopedic problem gets, and we're still not there. And then I think for for the profession to not be afraid to also talk about the intersection of trauma and mental illness. It took me a long time to figure that out, that the comorbidities of trauma and mental illness are where the biggest problems are, and we've got to talk as a society about why we allow for so much of this trauma to happen. So many kids who grow up in violent neighborhoods, who grow up with with dysfunctional households, who are hungry every single day when they go to school. And mental illness is hard enough, but when you compound it with this increasing level of trauma that especially kids are facing, but adults as well, in an economy that's left millions and millions behind, it makes the job a lot harder for the system. So I think we've got to talk about those two issues together more, and we don't enough.
Mm-hmm. And I'm glad to see in general healthcare more talk of the ACEs study, the Adverse Childhood Events study, that's becoming part of the vernacular. It also brings to mind one of the things that I've really appreciated about your involvement in the dialogue, Senator, is because you get asked a lot about Sandy Hook.
Yes.
And when you say trauma, I actually also thought about violence, and really appreciate the way that you're able to navigate that and use it as an opportunity to talk about the broken system and what needs to change, but also to de-link violence from mental health, because it's unfortunate that that does get linked so quickly in people's minds.
Yeah, I mean, I went over to the White House. The president invited a handful of us over a month or so ago to talk about the issue of guns, and it was outrageous the way that President Trump was talking about mental illness. He continued to talk about making sure that no one with mental illness has a weapon, as if everyone who is mentally ill or has a mental illness diagnosis is dangerous. That is the worst kind of stigma to reinforce. Studies show that about 2 to 4% of gun crimes are committed by people with diagnosed mental illness, and of course, someone with who's mentally ill is much more likely to be the victim than the perpetrator of a gun crime. And the United States doesn't have any more mental illness than any other country, and yet we have 20 times the rate of gun violence. So it can't be mental illness that explains why we have a problem with gun violence in this country. It's something else, and of course I think it's our gun laws. Right.
And stricter, I heard at one point that there was talk of registering people that came in for treatment at a psychiatric facility, so that that could be vetted with permits to get a gun, and that to me is a huge barrier to people seeking care. So Senator, I can't thank you enough for your time with us today. It's most importantly for being, as Dr. Santopietro said, one of the leading voices for mental health care reform in our country. It is much needed and, of course, near and dear to our hearts. So thank you again for your time today.
Well, Tracey, thank you for being such an amazing advocate on this issue, and John, thank you for everything that Silver Hill does, and look forward to keeping in touch and working together.
Great. Definitely. Thank you very much.
Take care.
We'll be back in a minute with more talk with Dr. John Santopietro from Silver Hill Hospital.
For 1 in 4 Americans, mental illness hits close to home. And since 1931, Silver Hill Hospital has also been close to home. For individuals and families facing the challenges of mental illness, Silver Hill offers a highly trained, compassionate staff that provides state-of-the-art care in a beautiful and private setting. If mental health issues hit close to home, remember, there's a world-class psychiatric hospital right in the neighborhood.
Welcome back to Straight Talk with Tracey. I am joined by Dr. John Santopietro, President and Medical Director for Silver Hill Hospital. And thank you for being with me today.
Great to be here.
So I know your path that led you to us here at Silver Hill. Tell us about the various levels of care, types of care that you've done. You've had a very broad, extensive, interesting path.
So first of all, you know this story, Tracy, but I don't know that others would, that before I arrived at Silver Hill 7 months ago, I felt that I knew you already because I had Googled Silver Hill and of course knew of it, but wanted to see what was going on, and I saw Straight Talk with Tracey. So that was wonderful, and here I am.
You're welcome.
So thanks for having me. Yeah, so just briefly, I'm a psychiatrist. I've been doing it for about 20 years, and as a number of people that go into the field I was sort of wanting to. I was fascinated by the mind and relationships and the brain, and was lucky to have really good training, and then wanted to save the world one person at a time, kind of thing. And but my first job was actually in an inner city hospital in Massachusetts, and I saw just how broken the system was, and immediately was afflicted, is how I think of it, with a desire to try to make the system better. So that has been I've been pretty involved in that for the last 20 years, and I was able to get a pretty good view of the system because I would be in a system, say in community mental health, and try to help that system do better, leave it better than I got it, and then move into a bigger system. So I saw along the way a lot of different aspects of the care that we deliver, which go from outpatient to inpatient to a state hospital, and then most recently at a big healthcare system before coming here, down in the Carolinas. So for 5 years, I was running mental health at a big, if you can believe it, 60,000 person company. It's a not-for-profit healthcare system that that still has 40 hospitals and 900 care locations and treats 2.3 million patients a year. So it was a really amazing opportunity to see what can be done at a large scale. So, and we were able, because of the system investing resources, we were able to do some pretty significant things. Just one of them was we were able to get mental health into primary care. So, because people generally have a primary care provider, but they don't usually have a psychiatrist. And so if we can get to them in primary care before they get, more sick, we can actually make a big difference. And
how did that get done? Was that sort of the home care model where there is a team approach? You have a primary care and there's somebody there that can do some rudimentary or basic mental health screening. How was that actually implemented?
Right, it's a great question. So we took a model that is a pretty proven model in the country. It's been around for 10 years. It's called the impact model, and it basically implants a new role into primary care. So in primary care, you have your primary care doc, and you have your nurse, and you have your medical assistant, you have the patient, but it implants another role into that scenario, which is the behavioral health provider. So this can be a nurse, it can be a social worker, it can be a psychologist. What we did differently, and there have been 90 randomized controlled trials showing that works. What we did differently was we took that role, because we had 200 primary care offices to get in, treating 1 million patients. So we really didn't have a way to build a big enough system to do that in person. So we wanted to do it using telemedicine. So what we did was we took that role, deconstructed it, and then reconstructed it with a team. So it was a team, literally in a bunker. It was a very nice bunker, and there were 25 people in 70 practices by the time I left that had treated 10,000 patients in 2 years, and their depression scores fell in half. It fell by half. But more interestingly, their diabetes score fell by a point. The hemoglobin A1C fell by a point. And there was no other intervention other than treating their depression, basically. So that was pretty cool. But at the end of the day, my career is about bringing the best care to the most people. And sometimes I'm on the most people side of that, and sometimes I've been on the best care side of that, which gets to Silver Hill. So, You know, as many people, viewers probably know, Silver Hill is a place that delivers extraordinarily high quality treatment. I mean, I wish that everyone could have access to the kind of treatment that our patients have access to. We've been around for 90 years. We have what I think of as sort of deep clinical soul. We have a culture that really knows how to get to know patients. And if you don't get to know patients, then you don't know what's going on with them, and you don't diagnose them correctly. If you don't diagnose them correctly, you don't give them the right treatment. And most people's experience of care in the mental health system is that people are not getting it right. They don't get the diagnosis right. They don't get the treatment right. So I really wanted to be back at a place where, frankly, I knew I'd feel comfortable sending a family member. And it is indeed extraordinary to be at Silver Hill and watch, you know, these 350 employees work as basically as one big team to wrap around these human beings that come to us in moments of great suffering, great confusion, and figure out who is this unique individual. We know you've had all kinds of diagnoses. We know you're on a whole list of medications. You may have had these tests. And we know you don't really think that's who you are. You know? So we're going to meet you where you are and create a space, literally, for you to show us who you are. And then we'll figure out how to work from there and find recovery with you. It's really quite extraordinary. It is.
We are one of the few private psychiatric facilities left in the country, if not the world. So it is, we have a legacy, but this level of care, the quality of the care that our patients receive at Silver Hill takes time, treasure, and talent. Is it, just to play devil's advocate, is it replicable in a larger environment?
Well, that's a great question, and there's really two parts of the question to me, especially when you bring up the word treasure, right? And coming on the heels of a wonderful discussion with Senator Chris Murphy, who is out there fighting on behalf of our citizens and family members that cannot access care at all or cannot access excellent care.
Right.
So on the treasure side, people may know that Silver Hill has two forms of treatment. There's inpatient, more acute treatment, which is covered by insurance, and then there's transitional living programs where you spend more time, usually about a month, and mostly that is out of pocket. And it's out of pocket because we don't have parity. You know, if I went into the hospital for a knee replacement or a heart attack, I would assume that I'd be getting cardiac rehab or rehab for my medical illness, and there isn't yet the same parity in treating mental health issues that, by the way, take longer to heal.
Right.
Because the knee is pretty straightforward. The brain is really not. And so if you had to pay out of pocket for a knee replacement and then rehab, it would be a hardship, as it is for many of our patients. And then the second aspect of your question is, which frankly, even though I've been here 7 months, is already on my mind, which is there something we can do to boil it down and figure out what is the essence of why the care is so great at Silver Hill, and in some way bring that, I think of it as like a flame, you know, the sort of clinical flame, bring that, because a flame, you can imagine taking some from it and it doesn't take away from it, and bringing that out to the rest of the community or healthcare system. And I share your enthusiasm in asking the question to imagine that that's possible. And we're working on it. I have some ideas. I'm just recently there. I think part of it has to do, maybe a good part of it has to do with the talented people that you talk about. They are incredible. They're mission driven. They are well trained. They're curious. They're smart. They work well as a team. Those things are transferable.
Yeah,
right?
that is true, right.
Is there some way in which we do it that may put a finer point on it? And then I think there's something about the way our clinicians are protected to bring more of themselves to the clinical encounter. I have no way of proving that at this point. I actually imagine putting EEG machines on people's, on our clinicians' heads, don't tell them.
Yes.
And measuring their brain activity or something like that, right? I mean, it's a little silly, but you get the idea that they're able to bring more of their minds and souls to the clinical encounter. Because I've been in, as you said, a number of different systems. There are passionate, curious, smart, intelligent, well-trained people out there. But there's a way that they have told me consistently in larger systems that the system works against them and makes it very difficult, if not at times impossible, for them to bring their full selves to the clinical picture. And it's sad. It's sad for them.
It is.
It's sad for the patient.
Mostly for the patients, yeah. So is the lack of parity in part due to the lack of biomarkers that we have in psychiatry, so that there isn't a prescribed and well-documented and almost guaranteed course of treatment as there is in other below-the-neck medicine? So in psychiatry, it seems to be more art than science. At least we're moving more towards scientific biomarkers, but we're not there yet. Does that hinder the parity? Because from one patient to the next, the course of treatment can be quite different.
The answer is yes and no. So is parity slowed up by, or the lack of parity caused by, not having markers and concrete tests? And absolutely, if we did, it'd be easier to measure and compare apples to apples. The way that that's not true is that because of the lack of parity, we don't have those biomarkers.
Exactly.
So, you know, in a sense, you know, we think of psychiatry and mental health as being somewhat behind the rest of medicine because the resources have not been put in to research. So we are still, at this in 2018, dependent in mental health in large part on what you and I are doing, talking. There's no blood test. There's no scan of your head or functional scan that we can do even today that will tell me that this person has bipolar type 2 disorder. And I think of it as almost like what it was like if you broke your leg before there were x-rays. Because there was a time before x-rays and there were doctors that knew you'd broke your leg in a particular way and they had to explain it to you. And then one day they didn't have to explain it to you, they just showed you a picture and said, here's your broken leg. So we in psychiatry are not there yet, if you can imagine it. The good news, and the brain is more complex than any bone. It's you know, 100 billion nerve cells. So you know, we're behind in resources and we're ahead in complexity. So the good news is that with the national dialogue that's happened in recent years, and people like Senator Murphy that fight for parity and against stigma, because stigma is the real driver of those funds not going into mental health, that there are more things happening in Congress. His Mental Health Reform Act is a big part, the 21st Century Cures Act was part of. There have been recent movement forward in opiate treatment at a national level, mental health first aid, suicide prevention. So it's happening, but it's going to take some time.
Yeah. So as a family member, taking off our clinical hats, as a family member, what are some of the ways that family members can ensure that they get good quality care whatever circumstances they find themselves in? What are some of the things that family members should look for?
Well, that's a really pertinent question because more people are, I think, aware of the fact that there is help out there. So there are more people looking for help. We have some data to show that, which is great. And it can be very difficult to figure out where to go. And with these days, when it's fairly easy for anybody to set up a website that looks good, you know, families can, and there have been some recent stories in the news. The New York Times recently had a had a piece about this. Families can end up sending their loved one to a place that they thought was good and is not.
Right.
So with just some basic things, you know, to think about. One is accreditation. So, you know, for instance, Silver Hill is accredited by the Joint Commission. We're a hospital. There's a certain level of sophistication and accountability that you have to have as an organization to be accredited by an organization. Not the only body that accredits, but having accreditation is one thing. Then I think, you know, well, there's really two ways. One is, you know, word of mouth, and you'd be surprised how many referrals get made to us because, well, we've been around for 90 years,
right.
and 87, 88, I say 90, but, and over that time we've developed a sense of trust with very, you know, learned and skilled clinicians. So that is one of the ways, for instance, that people come to us, find someone that you can trust that helps you navigate the system. And then just some basic things to look on websites when you look, how many psychiatrists are there? You know, for a fairly, you know, mid to small sized hospital, we have, you know, a medical staff of 15. That's a lot of psychiatrists. We have a lot of psychologists. We have a lot of licensed social workers. So how many clinical staff are there?
Right.
You know, sometimes there'll be a treatment center, and I'm not saying they may not try, they're trying to do a good job, and they may be new, but they have one psychiatrist for a whole treatment center. And so things like that, and yeah.
Yeah. Any final words before we depart today on the state of mental health care in the United States?
Yeah, well, I was just thinking, Tracey, about our, you know, we talked a little bit about where Silver Hill might be going in terms of can we bring this clinical flame out. But it is worth mentioning that for the first time in a little while, we're launching a new program, which is called the Steward House at Silver Hill. And it is designed for executives, for leaders, CEOs, people that have responsibility for a lot of other people. That often don't get care because they either they want to be around a cohort of people like them because it just feels more comfortable, and or they feel it's very hard to disconnect from work. So, you know, in most treatment centers you don't have connectivity through a computer or the phone, and in an executive program, you do. There's a work center, and there's a way to remain connected to work, and there's a program designed around the behavioral health and or substance use needs of that population. We're really excited about it. It's in collaboration with Yale University, both the medical school and Yale New Haven Health System, which we've had a relationship with for some time, but it's at a deeper level, and I think speaks to the quality. And like you said, how do you know it's a good program? And Sam Ball, who is the director of the program, is a full professor of psychiatry in the Department of Psychiatry at Yale University, an extraordinarily talented clinician. And along with Dr. Eric Collins, who's the physician-in-chief at Silver Hill, they'll be leading the charge. So really excited about that. But thanks for having me, and I'm glad I made it.
Yes.
To Straight Talk with Tracey.
Well, you've come, now you're actually in the seat, and we couldn't be more pleased. We're thrilled to have you at Silver Hill, and I look forward to the continued innovation that you bring to the hospital and to mental health care in our state and, I believe, our country. So thank you for being with me here today.
Thank you.
Thank you for joining us for another edition of Straight Talk with Tracey. We'll see you next month.